I think that's the big crossroads we come to, because I can get a lot of information. What do we do with it? Middle ground, so short of imaging first, do we send off a degenerative myelopathy blood test? So because this is a genetic disorder, this Lou Gehrig's disease, there is a blood test that says, what is your genetic status? Because what you get for this one, it's an autosomal recessive trait. So you need 2 bad copies of your genes, one from mom, one from dad. So we can test for the gene itself. And if you get 2 good copies, guess what? You can't have this disorder. You can get 1 bad copy, one from mom or one from dad. You are a carrier. You could pass this off to your offspring, but you're not going to get this disease. If you get 2 bad copies, you are predisposed to having a degenerative spine disease, but not everyone goes on and develops it. 70% of dogs that test positive will develop spinal cord weakness due to a genetic degenerative process. 30% never do. And so it's a better negative test than a positive. But if you turn it positive, then you're like, crap, this really could be. So you can test genetically and see, do you have positive or negative? Because if you're normal, it's off my list. Or we continue to treat with medications, alternative therapies, acupuncture, laser, steroids, gabapentin, because I do think we heard a little bit, omega-3 fatty acids, natural antioxidants to reduce inflammation in your system, and time, and watch your progress. If things start heading the opposite direction, we're getting better, better, better. Awesome. I don't know what we're after, but things are working.
Right.
And then we start tapering down, and we adjust your medications. And if you stay on that upward trend, phenomenal. If you reduce a drug dose and you worsen, oh crap, I know there's something there, I just don't know what it is yet. And we helped. Do we just go back up on drugs, or do I get more aggressive with testing to find it at that point? The downside of treating without knowing is I don't know what I'm after. Yeah, this is the crossroads we come to, is image spine, genetic test. Other downside of genetic test, it's a blood sample, it's easy to get. It takes about 2 weeks to get back from the lab. They used to run it every single sample they got. They'd run it right then, but the reagents have gotten so expensive, it would be $4,000 per test. So we don't do that anymore. They wait until they have 10 samples, and then they put it in the same tray, use the same amount of reagent, and then track your genome. Just for that one genetic abnormality. It doesn't test for anything else. But you have to wait till you get 10 samples. So we could be number 1, you have to wait for 9 more, or it could be number 10. And then they run right then, and it takes 7 days. But usually somewhere between about 2 weeks is the average to get a result.
Wow.
Yeah, no, this is a lot of fun, right? A lot of info. So there's something wrong. It's your spinal cord. I think it's your neck more than your back. Few different differentials on the list between wobblers, disc and wobblers, fluid pockets, tumors, cancers, degenerative processes, and everything else in the world. Ways to find out. But where do we go?
I think her person, the goal was to make her as comfortable as possible. Because we don't know if she's 4 or 6.
Right. Or older.
Or older.
Right. If you were 2 when you got us 2.5 years ago.
Yeah, she was.
And you were 7, now you're 9.5.
Yeah.
What's gray period lifespan?
8.
8 to 10.
Yeah. So, and I know she's already tried a lot of alternative therapy. She's had acupuncture. She's had water therapy. She's, not that she wouldn't try that again, but I'll have to ask her about the blood workup.
Yep.
But I think right now she's really concerned about keeping her comfortable.
Oh, me too.
Obviously.
I think treatment-wise, from a medical standpoint, taking a more conservative route, I'd be prednisone, because it's the best anti-inflammatory I have for most of the physical things that could be there. No matter the problem. The only thing it won't help would be Lou Gehrig's disease. I would use Prilosec
She's
or
on
Meprazole.
that.
And the reason, not only for your GI tract, but if you have one of these fluid pockets in the spine, Prilosec has been shown to decrease the production of spinal fluid. So you're turning down the faucet, so the fluid's not building up as much.
Oh.
It's still there. It's not going to completely go away, but we're slowing down progression.
Mhm.
Using gabapentin, Neurontin. People use the same drug. It's excreted by your kidney, so it's very safe to use. It causes mild sedation in the majority of our dogs. So, I mean, we're already pretty blasé. So we're going to be a little bit more, but it's the best pain medication I have that can be given orally. The added benefit, and there's a research study in mice that shows that those that have spinal cord injuries of any kind that are given gabapentin versus placebo get better faster and to a more complete degree than those that don't get anything. So gabapentin has neuroreparative properties for reasons we don't understand.
Mhm.
Excellent.
The other thing I usually will use, except you have a recent history of diarrhea, are omega-3 fatty acids, fish oils. They're natural antioxidants. They reduce inflammation secondary to everything. Great for all body systems, eyes, hair, skin, heart, lungs, liver, kidneys, joint, muscle, bone, connective tissue, particularly your nervous system. We're giving back the lipids, the fatty acids that are meant to repair and are the building blocks for your nervous system. But it's an oil, and it lubricates your GI tract and can lead to loose stool diarrhea. Although I don't see it very often, maybe 5% or less, I think the benefits would probably outweigh the risk. But if you wind up with loose stool, we knock back your dosage or discontinue temporarily.
Okay.
Because that's a lot of poo that you'd have to deal with.
Trust us, we know.
You know. That's kind of ridiculous.
She got it on her tail, and then she proceeded to walk by the door like a paintbrush.
Jackson Pollock, I'm telling you.
That's awesome.
She was
Flinging it.
giving us our own biz. I threatened to chop it off. I kept forgetting.
Oh, the tail, the hair.
Yeah. We'll fix that shit right now.
Now,
Betty's in
That's
Philadelphia.
like
Remember.
And yeah, and do we talk about more doing the holistic alternative things again? Acupuncture, laser, physical therapy, underwater treadmill activities, CBD oils,
she takes that
Yep.
occasionally too.
and because they have lots of like anti-cancer properties, neuroreparative properties, but they're going to make you more tired. So
It's hard to tell with her.
I know, it's
She's
the
always
same.
been like this. But yeah, I think Betty would be all on board with starting at that level.
yeah, start here.
Yeah.
If we need to do more,
We'll do
guess what?
more.
We can.
Mhm.
Because there are things I could find and I could fix, make you better. 95% back to normal. I never say 100% because some of, if there's pressure, you ruptured a disc, some of the cells on the inside will die off because they're not getting oxygen, they're not getting nutrients. And even if I take that pressure away, there's some cells that don't recover. But clinically apparent, yeah, most of our guys make awesome recoveries. Wobblers is harder, fluid pockets are harder, Lou Gehrig's disease is harder because there's no treatment for there other than supplements and time. But do we trial gabapentin, fish oils, Pred, Prilosec? I think that's a fair course. And then your updates, phone calls, emails, videos, show me what you're seeing at home. Now we take it day by day, week by week.
Okay. I think that's a good start.
What do you think?
Betty will be
Schnockered.
She's supposed to be flying in this afternoon, so she'll be back home. We can go over all this with her.
And it's videoed.
Yeah. And I don't have to hear the haunted doll voice she uses on the dog. Haunted doll voice, Betty.